Good evening. I'm Shirley Nowlicott. Diana Williams is off.
And I'm Sade Bitter-Edouard. Tonight, the health department in Nassau County is investigating an outbreak of the mumps.
There are 18 cases so far, and health officials say most of them are in Long Beach. But as Eyewitness News reporter Stacey Sager explains, they have concerns that number could grow and fast.
One of the busiest spots here on Long Island this summer, and city officials are hoping it stays that way, but with added precautions, extra care in sanitizing eating utensils and hands due to an unfortunate outbreak of the mumps.
Take all the normal precautions that you would take whenever there's any sort of illness going around. The patients themselves have been in their 20s, not necessarily childhood age. And from there, we ended up doing the proper testing on them, and then we had the confirmatory test tell us that, in fact, it was the mumps.
18 suspected cases so far, most of them in young adults, people in their 20s, and additional cases are expected. County health officials theorizing that while the initial case might have been someone who didn't have the vaccine, many other sick patients had the shot.
We may be seeing a strain of mumps that the vaccine doesn't cover 100% perfectly.
But they say the vaccine is still the best form of protection, that if you haven't gotten both of your 2 MMR shots, you should. Health officials also say if you think you have the mumps, the best thing to do is to stay put in your house for at least 5 days. But if you must get medical attention, tell someone here. Don't sit in a waiting room. Symptoms include puffy cheeks or a swollen jaw, a low-grade fever, muscle aches, fatigue, and a loss of appetite. Here on the boardwalk, more concern than panic.
We don't know why it's happening. It's scary.
But definitely common sense to round out the summer.
Just stay calm and live on.
In Long Beach, I'm Stacey Sager, Channel 7 Eyewitness News.